Hello, everyone. Can you hear me okay? Awesome. Welcome, everyone, to the First Responder Resiliency Program. Happy Monday, pre-Thanksgiving. Hope everybody is doing all right and staying safe in our world as we continue to adapt. And that's a little bit, I think, what we'll talk about today. For those of you who've joined us before, it's great to see you again. And for anybody who's new, thank you for tuning in today. I see many familiar faces, and it's great to see you and to be connecting in these trying times. We will have a structure similar to what we've had. We will have our expert speaker, Rachel Call, who we are very fortunate to have join us both today and in 2 weeks. And then we'll, after the presentation, which will be about half an hour, including questions, we'll break into our listening groups for about 15 minutes. For those of you who don't know about that, that's where we are assigned groups at random, and those of us who are on the hub team facilitate a conversation really with a basis in what we hear today. And then we'll come back for the last 5 to 10 minutes to regroup and share what we heard in the other groups to connect together before this crazy holiday that we're about to all embark on somehow. So welcome, everybody. There will also be a link to continuing education in the chat. And I know Rachel is very skilled at Zoom with polls, and I'll monitor the chat so that if you want to send in a question at the end of her presentation, we'll also get to those. So it is an honor for me to introduce Rachel Call, who is the Behavioral Health Lead in the Readiness Division of the Office of the Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services. In this role, she provides guidance to the federal, state, and local disaster behavioral health, public health, and response communities throughout the country in promoting expansion and improvement of behavioral health services and resilience promotion. Rachel has extensive experience working on stress mitigation and workforce resilience for responder populations. She was the coordinator for disaster behavioral health for the Maryland Department of Health and Mental Hygiene, where she developed and coordinated training for police, fire, and EMS on managing stress threats related to disaster response. Prior to that, Ms. Call was the coordinator of crisis response services with the Employee Assistance Program at the Pentagon for 2 years after the 9/11 attack, where her primary responsibilities were establishing trauma reduction programming for the civilian population there and providing direct trauma-related clinical services as an EAP counselor. She facilitated the establishment of a peer support program for the Pentagon police force and served as its clinical advisor for 3 years. Rachel's been a responder for community and workplace crisis teams and the disaster mental health lead for the Arlington chapter of the American Red Cross. She was an on-site responder and coordinated Red Cross disaster mental health response activities at both the Pentagon and at the World Trade Center after 9/11. She's published articles and book chapters on disaster mental health and emergency response, death notification, stress management, and crisis intervention. Her expertise includes developing peer support, stress management, and crisis mitigation programs for emergency response in military populations. Ms. Call is a clinical social worker and a certified trauma specialist. And boy, are we lucky, Rachel, to have you with us today in these growingly crazy times that we are in. And so welcome. You can get a resounding applause from all of us should we not be in a pandemic. So thank you so much for being here today.
Thanks for the invitation, Jeffrey. I really appreciate it. I was going to say, after hearing the bio, I think, wow, I'm getting old, but that's okay. Many years of experience behind me.
Very wise.
Right now, a valuable thing. But and I just by way also, I'm a social worker. I started my training and really developed many of my skills working in hospital settings as an ER social worker, as well as in physical med, rehab, and brain injury programs. So I was really excited to get the invitation to speak to this group because it's such a mixed group of folks in settings that I care passionately about. Let me go ahead and can we put the first slide up, the title slide for me? so I can see what I'm doing here. So a couple things. I was trying to think how I wanted to approach this when Jeff and I were talking about sort of looking at stress and individual resilience. And, you know, we've been doing this, thinking about this stuff for months now in relation to COVID. And, you know, my group started thinking about it really in January, and with a focus on healthcare workers, first responders, public health workers. So I just kind of wanted to take a pause and say, okay, so where are we now? In the months of the many presentations and groups I've talked to, I've learned a lot from them in terms of what they find is most challenging, the conditions they are most concerned about, as well as what they have found to be potentially useful in developing strategies to cope with them. So I'm going to share those with you, and some of it may not be completely new content, and some of it may just be framed in a way that you haven't thought of before, but I'm hoping everybody kind of gets to go away with some new thinking or some additional thinking on how to incorporate strategies into your professional or personal practices. Really quickly, before we go into content, I tend to use the Zoom chat box a little differently than some people might, meaning I really do like to ask questions and input, and may ask you guys to type stuff into that chat box sometimes during the presentation, so that I can also get gain from your experience and expertise. So when I do that, feel free to do it. We'll also have a couple opportunities for polls, so we can get a sense of kind of where people find things resonate for them. And there's also going to be, throughout the slides, there's links directly embedded in the slides to resources and information, as well as a page at the end with additional resources and information. So I want you to know you'll have those. And anything that we touch on, there's going to be a resource for you to delve further into it if it's something that really interests you. So with that, I'm going to go into just the learning objectives quickly. We sort of talked about them already. Next slide, which is really, I want to give you a little bit of a sense of what I do for a living, because that is something I'm still trying to often figure out how to define appropriately, but then really go into the workforce stress that we see now, particularly in the kinds of settings that many of you work that relate directly to COVID-19, and then look at the mitigation strategies on an individual basis. In a couple of weeks, we'll be looking at more organizational strategies. So I may mention things that can be used inside of organizations, but I'm really trying to think about sort of the individual strategies that you can apply. So before I get started, just so I have a sense of who's on the line here, we're going to do our first poll, which is really just trying to find out your practice setting. So can you launch the first poll for me, please? And just what practice setting best describes where you work? And if you don't really see yourself there, feel free to type that into something into the chat. But are you in a hospital or healthcare setting, maybe a freestanding clinic? Are you in a community-based setting? Any kind of a first responder, EMS, police, fire environment, or potentially academic? Public health? I'm only allowed five options, so I apologize if you don't see yourself there. And our public health folks, particularly working at the county levels and local levels, are just so important. Faith community, terrific. Okay, state public health, and then yes, nursing homes, assisted living, long-term care. Okay, great. Okay, thanks. That's great. All right, close the poll for me so I can get a sense of what people answered. All right, so now we see a lot of folks in hospital and clinic settings, but also a fair amount in community, as well as EMS and academics. So that's a nice mix of folks. So hopefully we'll have some robust examples coming in. I'm gonna do something that I know some people like to have people on camera the whole time. I'm going off camera mostly because it helps me concentrate on the chat and the content, and then I'll come back later. Otherwise, I'm distracted by my own facial expressions, and so I'm gonna try and stay focused for you. So I'm gonna go off camera temporarily. Thanks. Okay, you can close this poll now, and let's go to the next slide. Quickly, just what's Rachel's practice environment? So I work in the federal environment as the behavioral health lead, and where does that fit? It fits within the Assistant Secretary for Preparedness and Response. Our agency within HHS is responsible for that public health and medical aspect of disaster response and recovery. And my role and my team exists to make sure that we're integrating behavioral health into our response and recovery activities, as well as into planning and preparedness. The vast majority of behavioral health activity during and after a disaster takes place at the state and local levels. But what we try and do, along with our partners at the Substance Abuse and Mental Health Services Administration, as well as other CDC, other HHS and federal agencies, is really provide technical assistance, linkage to one another, coordinated communication, and access to the kinds of resources that will help at the state and local level to really recover from and mitigate the effects of a disaster and recover from them. So that's my practice environment, but I come to it from the field, and that's really important, I think, is to understand what it is like to work in the community or in a hospital setting, because these policies and tools and resources really need to be usable and implementable in the actual settings where people are providing care. Next slide, please. So when we started, and I say we, it's really my team, I've got several folks that I work very closely with, started looking at COVID and what the stress threats would be. The thing that really resonated with us or really struck us was, in general, all of us work in sort of an environment where there is a steady state. Even if you're in a disaster agency, there is a steady state. A disaster or an event comes along that disrupts things, and then you work hard to apply things that help you get back to that steady state, right? Even if that steady state is somewhat different because of the effects of the disaster, you sort of want to get back to your day-to-day work. And we address stress different ways at different phases because of that. What we found with COVID that was so challenging and remains challenging is that steady state, the pandemic began to escalate. And what we found is everybody was in this sort of sustained operational engagement. You can see there is no bridge back to steady state. Even if you were directly working, taking care of people, responding to communities, you go home and there would still be COVID concerns at home. There remain concerns in the workplace, no matter how many tools they bring to bear with it. So that the way in which we normally talk about stress and advise on how to manage that stress becomes much more difficult. The barriers become much more, there's more of them and they're harder to overcome. Next slide, please. The other challenge here that we have found is that many of us that are called to do the kinds of professions you all are called to do remind me of this cartoon character on the right, where we're called to do the work where we are helping others with their stress and their pain and their distress. And even when somebody asks, hey, do you need some help with that? We're likely to say, I think I got this. I'm called to do this. I'm motivated to do this. I want to do this. And then burden gets heavier and heavier, and we have a harder and harder time often asking for or even accepting help, even when we find ourselves underneath that rock at the end of it. If you notice, the character's still got 2 thumbs up. I'm doing good. And I don't know how many of you feel like you've ever been in that cartoon, but I certainly have. And have really worked hard to try and figure out how to help get that burden shared so that I'm not crushed under the rock of it, so I can keep doing the work that I love to do. When we've talked to folks within the last few months, what we've heard is a lot of different kinds of things stress them. Not everything. People have very specific things that they are finding more challenging during this time. I'm going to ask you to just look at those stressors that we've sort of listed out there. It's not an exhaustive list, but put in the chat box the number or numbers that resonate the most with you for me. What kinds of things have you found most challenging at this point, or maybe as time has gone on, that was really been distressing or caused some difficulty functioning? Okay, and so some folks have talked about increased workload. I know a lot of us have felt that way. Many people are having limited days off, certainly not the long breaks we were used to in the summer. Prolonged exposure to the human suffering and distress. And just when we thought we'd sort of gotten over that hump in some of our communities, we're certainly finding that has increased. I appreciate some of you are putting in multiple numbers. The changes in guidelines have been incredibly stressful for us at the federal level as well, as we try and keep ahead of the science and the information and be clear and accurate. That has been extremely difficult. And then of course there's that risk of exposure, and not just exposure to self, which maybe in our professions we're used to, but the risk of what does it mean if I expose myself and therefore expose my loved ones or others. So that's been hugely difficult. And then I've seen some folks with changes of roles and responsibilities, and the professional workloads. PPE related challenges were certainly a concern early on. Those are starting to kind of become something we're taking another look at, because as much as we've solved the early parts of that problem, we are in another spike all across the country, and that's certainly a risk. So, all right, thank you. That really helps me understand. So you can see a lot of us have been exposed to numerous stressors. A lot of you experience the same things, but not everybody. We all are sort of finding our own experience of this is pretty individual. Next slide. When we started talking to healthcare workers and we started talking about taking care of yourself, first responders as well, we found that the language we were using wasn't resonating. And what did resonate was asking folks how we could help them ensure their best performance. So linking that stress and that very high level of stress to performance became an important way to communicate strategies to cope. So I remember in March and April, and I look at that continuum, and I was clicking on a lot of cylinders. I was being extremely creative, pretty effective, even though the stress level was very high. And then I found as time went on, particularly in the summer, that I was starting to experience a decrease in my ability to concentrate effectively, to make decisions in an organized way, consistently. And certainly I found my interpersonal skills were not always stellar. So, and this of course would also create problems in the household or at work. So we really wanted to frame thinking about the continuum of stress from a performance perspective, just based on this audience. They tend to be people who signed up for high levels of stress, tend to excel with high levels of stress, but this has just become ongoing, difficult, and kind of relentless. Next slide, please. And the other thing we were hearing is that those signs and symptoms of stress that normally we're used to, like what are my red flags? How do I know when I'm stressed? Some of those started changing for people. The sort of normal way in which I know I'm stressed, I get a headache, or I find my appetite changes. That wasn't happening so much anymore. I was finding there were new signs and symptoms of stress. And while I'm kind of talking about this, what, if any, did you notice about your signs and symptoms of stress? How do you know when stress has become at a level where it's a challenge that probably needs to be addressed? Just any examples anybody has for themselves. I know we've heard from several people, particularly in the last couple of months, that people have started having COVID dreams, right? Dreams with these really, that are kind of distressing and disturbing around COVID. Irritability, sort of mood and the way in which you interact with people. Physical conditions that are usually managed become worse, heart conditions, diabetes, respiration. I'm meaner to my husband. I understand that. I understand the having it more difficult to be nice to the people in your household who you normally are quite affectionate with. Less patient, withdrawal. Now that's another one. I certainly have found that in myself, and I'm not someone who's normally withdrawn when I'm stressed. I always say I've never seen a stressor I didn't want to jump. I want to get out there and do something about it, and I certainly have found that too. And everybody talks about things like the eating and appetite. Some people have experienced weight gain, weight loss. So that's great. Thank you for those. But the point with this is, if you think you knew your red flags before, the things that make you kind of take a step back and say, hey, I need to do something, take another look and do some thinking around what are the signs right now, and are they the same? Are they worse? Are you finding new ones? Because new stress symptoms may respond to new stress mitigation strategies. So it's a good idea to start there, so you kind of know the direction you want to move in. Next slide. And as we started talking about the kinds of conditions that we were concerned about people experiencing, we'd start the same conversation that many of you have probably heard before or had yourselves, where you look at stress from sort of these buckets of acute versus chronic versus traumatic. We talk about symptoms that align with those, and then we talk about conditions that result and ways to mitigate those conditions. What we found in the last couple months, 3 or 4 months really, that has been concerning is conditions that we would not normally see on a regular basis in healthcare and first responder populations. We're starting to hear and see more of them. And those are the bold conditions you're seeing: compassion fatigue, caution fatigue, complex grief, and moral injury. These are conditions and circumstances we knew about, but we hadn't seen them in this population quite as much as we've been hearing about it now. So I'm going to take a few minutes to just go through each of those main conditions and then talk a little bit about mitigation or ideas for coping with them. Next slide. So burnout versus compassion fatigue. When I used to teach this, I've taught this topic for many, many years. One of my first purposes was to pull apart burnout and compassion fatigue, because a lot of folks use those two terms almost interchangeably, and they're not really interchangeable when you're looking at how to mitigate them. Question in terms of compassion fatigue, just to make sure we're on the same page, is this a phrase and a condition you're pretty familiar with? Put a Y or an N in the chat box just so I can get a sense of how many folks are pretty familiar with this or not quite. Okay, I'm seeing a lot of yeses, a few no's, not really. Great. So the main thing that's been a challenge in talking this through lately has been that with burnout generally a condition that results from being under-resourced or underappreciated, feeling that one's efforts can't really take care of the challenge that one is put out to do, and there's a fatigue to it. Compassion fatigue is a little different in that it is almost the result of being good at what you do, if that makes sense. It is almost being psychologically injured by other people's distress and trauma. And the way you get injured by it is by being able to connect and to empathize and to really engage with people who are in traumatic or distressing circumstances. And what makes it tricky is often one is still very effective at one's job, even when one has been or is being injured by the work that they're doing. So when we talk about how we're going to actually cope with these things or heal from these things, we got to think a little differently. Now with COVID, the burnout and compassion fatigue, quite frankly, is sort of more like a Venn diagram and overlapping more. So addressing both is often extremely necessary, as opposed to just defining it as one thing or another. So that's been pretty challenging. Next slide, please. Thank you. Now I'm going to ask the same question for moral injury, which I'm wondering, I know that there's been at least one presentation that this group has done on moral injury, but just for this crowd today, is this a condition you're familiar with? Sort of understand what it is? Yes or no? Y or N in the chat box? Okay, great. Okay, I'm seeing a mix. A lot of you are familiar with it. What's been interesting about moral injury is it's a condition we've known about for a long time. We've been studying it in veterans and military members for many, many years. And what's different now is we're seeing moral injury more in healthcare, public health kinds of environments or populations now, more so than we used to. Moral injury being exposed to, witnessing, or having to do things that really are counter to one's own moral compass, one's own set of beliefs, one's way that the world should work. And the result of guilt, certainly the stigma attached to it, can become extremely disruptive for folks in their daily lives. So the one thing I will say about moral injury is unless we start talking about it, we're not going to be able to recognize it in each other, in our colleagues, or in ourselves. And then we won't be able to assess it, and we won't be able to treat it. Because the good news about moral injury is it has been around and studied long enough that there are many treatment modalities that have been shown and have evidence to be pretty effective at managing it and treating it. So those links will all take you to training and or more information, just to give you kind of a sense of what kinds of things can one do to address moral injury. And I really have been recommending, we've been training behavioral health providers and encouraging them to get more training and education about this condition, particularly if they work with first responder or healthcare professionals, as we're seeing this becoming more and more of a common concern. And we'd like them to know how to, if not treat it, know how to assess it and refer for appropriate treatment. So when you have a chance, I really recommend you do a little more reading on that. We have some resources as well as the links here that can provide you more depth. Next slide, please. Lately, complex or complicated grieving has been a very hot topic of conversation. With complicated grieving, it can show up with maladaptive thoughts, dysfunctional kind of coping behavior, the fact that we've been denied the normal rituals and gathering and comforting measures that we normally take to manage losses of colleagues, losses of patients, losses of people in our community, and even losses in terms of things we used to do that kind of make us who we are. So complicated grief is a big concern that is getting more attention. The link at the bottom is to an article that came out in JAMA in June, where they link mental health conditions to these COVID-related deaths. And one of the surveys they did shows that people are reporting 3 and 4 times higher levels of mental disorder and mental distress than they were a year ago. And they link that to sort of living in this environment of the pandemic. Also, the symptoms of grief are showing up more like PTSD. So again, I recommend you take a look at this article so you have a sense that there are things that we can do. A lot of them require kind of a public health education approach, helping people understand what grief looks like right now and that it may not look like it has in the past. Also helping primary care providers and other sort of healthcare professionals understand that when people come in with certain symptoms that they'd normally link to trauma or anxiety, they should also consider looking at what kinds of experiences around grief and loss they're seeing with folks so that they can help them get the assistance that they need. Next slide. Caution fatigue. Now, this is a term that came out of this EHCO group, quite frankly, because it was not one I'd heard of. I'd heard of COVID fatigue and pandemic fatigue, but caution fatigue was one that really came out of here recently, and I've heard more health professionals concerned about it. That notion that the things that we need to do to really stay safe and vigilant are just, people are just tired, and they're starting to take shortcuts. I'm wondering for you guys, what would you see that would be an indicator of caution fatigue? What might that look like in your work environment or even in your personal life? What would caution fatigue look like? All right, not wearing masks. That's usually the first thing people come up with, is the mask wearing or the half mask wearing. And coworkers, family giving up on wearing masks. Yeah, sort of not doing the things you normally do to take care of yourself, whether that's exercising or eating appropriately, not physical distancing. I've noticed that quite a bit. I'm getting a lot more invitations for outside barbecues or gatherings that it used to be maybe one couple would say, hey, can you guys come over? But now we're having a few people over. Right now, given the numbers, I find that pretty concerning, but I also understand it. And I try and understand it as a form of coping for people, trying to kind of get back to as normal as they can, given the restrictions we have. The problem is the consequences are pretty high. So I know I don't have to tell you that, but I'll talk a little bit about what we've been hearing seems to be helpful with that, but the caution fatigue is one that's going to be very important in the next few weeks and months. So given that I've just kind of gone over quickly burnout, compassion fatigue, moral injury, complex grief, caution fatigue, I'm going to ask for the next poll to be launched. And I'm just curious as to, given your environment and where you work, what do you think you're at most risk for in terms of these conditions? Let's go ahead and take a minute and get in your answers. All right, let's go ahead and close the poll and just see what folks had said. All right, burnout. Yeah, people are working really hard, and compassion fatigue. That's really good. So knowing those two things, the one thing I can say is there are things one can do individually to actually manage those things. So we'll talk a little bit about coping. Can I have the next slide, please? For caution fatigue, one of the analogies I'm making is kind of think about it like if you have a technical hobby like scuba diving or skiing, you know, sort of a mental or even a physical, an absolute physical checklist. Go down that checklist. Do you have your mask? Do you have your hand sanitizer? Do you have your plan for what you're doing? Did you wash your hands when you come home? In my house, we have sort of a buddy system for that, and we make sure that we're reminding each other of the behaviors that help keep us safe. There's also thinking about what's motivating your behavior, really taking a minute to think about why one wants to take a shortcut, or what's motivating you to maintain the kind of vigilant approach to risk that you've been taking. A friend of mine recently purchased a bunch of very fun and creative masks. Do something that sort of rewards you for doing the actual caution, right? So I bought one that has unicorns on it. It makes me very happy. Next slide. And also, let's take a pause and think about our individual coping strategies, sort of looking at that foundation that we all know make up coping and good stress management. What are some things we could do differently? What are some things we could increase that maybe things that we know have worked for us in the past, or things that we haven't tried that might give us kind of a new outlet? Really thinking about those coping strategies. And the other thing I wanted to highlight here, the linked digital psych app evaluation is a really nice database of apps that are related to mental health and resilience that the American Psychiatric Association has compiled. It gives you a nice summary of what the apps are useful for, whether it's for you as a provider, you for clients or patients, as well as what the evidence behind them is. And if they're linguistically, culturally competent. So if you're looking for something that can help promote or sort of inspire you to do something different, I recommend taking a look at that. And the other thing I'd really recommend that I've been doing lately with my team is thinking about what really is motivating us right now. What's motivating our best behavior? How can we hang on to that? Can you launch the next poll for me, please? When I was talking to my team, some of the things that they mentioned in terms of what motivates you to get up, go to work every day, do your best, and be great at home too. They came up with some phrases. This is just a few. Of these, which of these resonates the most for you? Like, what helps motivate you to sort of promote coping, promote your own coping, do your best work, be as resilient as you can be? All right, next slide. I mean, not next slide, sorry. Can you close the poll, please? All right. So the idea of being able to contribute is often a big one that I hear. And that there's, you know, people practicing gratitude. I'm glad to see that. That's an important step that we sometimes skip. All right, good. Thank you so much. That's helpful. Next slide. What happened for me a few months ago when I was feeling profoundly not motivated and a little overwhelmed with just the sheer magnitude of what we were dealing with as a nation and in my own agency, is I attended a presentation by two providers that work at the Uniformed Services University of the Health Sciences, USIS, it's the Army Med School. And they were talking about a program, their Consortium for Health and Military Performance, CHAMP is the acronym. It's linked on the right, where they teach and work with combat soldiers on how to really build an optimistic, resilient mindset, but optimism being a cornerstone of it. And that kind of pricked up my ears, because their notion is, look, there's a way of building this mindset even when it's hard to be optimistic. And I found that really interesting. And I particularly liked that they defined optimism differently than I'd heard about it before. It's not sort of Pollyanna or looking at everything on the bright side as I'd sort of thought of it in the past. It's really an optimist. A true optimist is actually a realist. A true optimist is somebody who takes a look at the situation or the conditions they're in and then assesses it and decides what they're going to do with it, right? So if you look at those images and you've got two glasses with clear liquid in them, an optimist doesn't just say, oh, the glass is half full. What an optimist says first is what's in that glass. So if the glass has water in it, the optimist thinks, great, this glass has water in it, and I'm going to see how can I get more of that good stuff, that good water into that glass. But if that glass has poison in it, instead of an optimist saying, well, at least it's only half full of poison, what an optimist would actually do is say, okay, how do I get that bad stuff out of that glass and replace it with good stuff? So they take a real problem-solving approach to it. And I found this really useful at the time when it came to me, because I was just having a hard time thinking that way. Next slide. So when you click on the link, when you look at these slides, it's going to take you to the page where they talk about sort of building this optimistic mindset. And the first thing it's going to ask you to do is go through sort of a self-assessment of where your thinking tends to be. And it may depend on whatever realm you're in. Is it how you orient to the future, other people, your work? But if you go through that self-check activity, next slide, you'll see there's about 10 questions. And then you can get a sense of, all right, where could I shift my thinking? Where do I want to put my attention and energy? Next slide. And then it'll take you through sort of some very concrete things you can do to alter the way in which you approach situations, even when the situation is pretty terrible, is hard to be optimistic about. So thinking about how you can control the controllable, compartmentalize the things that are out of your influence, take small productive action and really find the good and recognize that. They talk a lot about coaching questions to orient yourself. And one of the ones I found helpful that Gabe Paoletti, one of the presenters, talked about is he gets up in the morning and sort of says, who can I help today? And I found that a really useful orienting question for me, because I can't help everybody and solve everything today, but there's always somebody I can really focus on helping today. And then I can reflect on that later, and that helps me find the gratitude and find the positives that I want to do more of that going forward. And that has really helped me in the last couple of months as things have continued to be difficult. Next slide. I don't know if you've seen this meme before. It was floating around on the internet in March and April. But it's this sort of graphic on who you want to be during COVID, and it placed certain behaviors or thinking in certain zones. The fear zone, that sort of reactive, impulsive zone. The learning zone, where you're trying to kind of reality check that stuff from the fear zone and say, hey, is this really the right way of looking at this? And then the growth zone, where you're taking, instead of looking inside, looking at yourself, you're starting to look externally. Like, what could I do? So who do I want to be during COVID? Do I want to be somebody reactive, kind of looking inside and being anxious, or do I want to look outside and take what I've learned or what I've come to know and really apply it so I can make a difference? So I don't think this is a linear journey. I think many of us have bounced back and forth depending on our experiences and what we're dealing with. But I do like to refer back to this to remind myself of kind of who I want to be as we go through this journey. Next slide. And the other thing I'd really want to recommend is to think about, these are different kinds of resilient skills. I know many of you have experience using these, helping others with these, but I'd sort of take a look at that and think, what is the resilient skill that I like to use, that I can use, or that I can use more of? An example for me recently has been, I realized that early on in this, when there was a Zoom happy hour every night, I was still in pretty much good contact with a lot of my friends and loved ones. But in this last several months, not so much. I'm kind of tired of always being on a computer or on a phone. But that has meant I've been somewhat disconnected from my support system. So I now on Sunday night sort of identify 2 or 3 people, both in my professional life and my personal life, that I want to get in contact with. And I schedule it. I put it in my calendar so that whether it's a text or a phone call or a video chat, I'm connecting to those people that give me energy and help sustain me through hard times. That's just an example of something I am reverting back to that's a resilient skill that I know I've let slide. Next slide. I'm going to wrap up, but I just want to just sort of say, I'd be remiss if I didn't remind us of when it's important to reach out, no matter who you are. Encouraging others to reach out when you notice these kinds of symptoms, this kind of thinking, this kind of despair. It's very important to reach out for further assessment and medical and/or behavioral health help. I noticed that at the beginning of the slides, you already had a reference to the Disaster Distress Helpline, which is a really useful resource for information, support. It's manned by trained crisis counselors 24/7, and they can also refer folks to resources in their own communities. And then workplace programs such as employee assistance or peer support are also important things to access when you feel the need or when somebody you work with or care about is exhibiting these kinds of symptoms. Next slide. So just to wrap up, here are some additional resources that will take you into deeper territory with all of the topics I've just covered. These are all linked and you can get, they also will lead you to further resources. So I'm hoping one of these or some of these become valuable or useful to you as you think about how you want to move forward with your practice in terms of your professional work or your personal life. But what I do want to acknowledge is the work that we're all facing right now is very difficult, and it can sound a little tone deaf to talk about self-care, but that's why I just really wanted to emphasize it's the small stuff and it's the small steps of moving forward that I think can really help us all at this time. I'm going to turn this back to Jeffrey now and let him lead us into more of a discussion for all of us.
Great, that was, Rachel, tremendous. Thank you. That was like an overture. Thank you so much. Do we have, are there additional questions that people have in the chat? All right, I'm thinking that we can go into breakout rooms, Karina, for about, let's see, about 12 minutes. Yeah. Oh, Karina wants a couple minutes to get the groups together. But Rachel, thank you. Thank you so much. My question just to you would be, are you seeing anything in particular now through your lens as we go into Thanksgiving and the holidays that is particularly kind of stressing people out that you're aware of now?
Well, I think the big problem is people have very real competing priorities. They're parents of children, young people who are coming home from college because they have to come home from college. They are trying to manage this school distance or online learning schools as their kids come home or on break, trying to figure out how to manage work and all of that. I think there's competing priorities, and I think we're tired. And I think there's a lot of anxiety and some frustration when people talk about hosting a Thanksgiving or going someplace, even though there's a lot of judgment, So I've been really trying to encourage people to listen and reflect that people are trying to cope. That's what they're trying to do right now. And I think just helping them understand their motivation and just how important this is for all of us, and then try and hold off on the judgment.
Yeah, so important. Yeah, that's so important. And this is a potentially judgy time for all of us anyway, even without what's going on. They make movies about Thanksgiving dinners. So yeah. All right, Karina's ready. So we're going to go into breakout rooms, and I would suggest maybe, given what you're talking about and everything that we're all aware of, and our disconnection that we're feeling, and compassion fatigue and burnout, maybe that we can share, given the week that lies ahead of us, maybe a couple things that we are grateful for as a group, since we do have the potential to tap into that right now. So why don't we use that but if people want to spin off in another direction, and Karina maybe like, maybe just 10 minutes. Is that okay? 10 or 12 or have a few minutes left. We can just summarize, and I don't want to get cut off before I give a big thank you to Rachel for the presentation, and we'll hear from Rachel addressing more organizational uh, experiences in 2 weeks. So just to give everyone a heads up about that. And yeah, if we can just share a couple thoughts from each of the group. Our group had people calling in from all around the country, all around, big group, and thankful for family and for people who still come to work, and for kids who were quiet during this call while trying to handle multiple roles at the same time, and for health and concern for the health of family members also. Hey, Dr. Romero, how about your group?
Yeah, we had just a really terrific group, very touching. I think everyone was just so spontaneous and just an outflow of gratitude for things in their lives, people bringing them food, painted rocks. And I think, we kind of were all sharing on our group that it's been a really hard week for a lot of folks all around the country. I mean, hard weeks, but especially maybe this week for whatever reason. And I think many of us, myself included, I was mentioning that before I got on the call, I was definitely feeling depleted, but getting on the call and hearing people's gratitude has just really given me like this great boost, and just how grateful I am for everyone here.
Awesome. Thank you for that too. I was scared to ask that question, so I'm glad it was. So great. Dr. Rosenbaum, how about your group?
Yes, thank you. Our group was great. And Dr. Romero, I felt exactly the same way. The group was so grateful. It was really uplifting. It was so nice to hear. And, family, friends, these kind of things, health. And then there were some interesting ones. Grateful for the rise of germophobia so that we avoid future pandemics. Grateful for having firearms, to practice and stress reduce. So I thought it was really a great group, and it was truly uplifting.
Awesome. Dr. Greenwood Erickson, were you in Dr. Romero's group, or you were on your own? Or you were the same group? Okay. Anything else? All right. Was there another group? There must have been. Shannon?
Yeah, ours were, we had a pretty big group, about 21, and I would say that one of the continuing themes was people being really, really thankful for being able to work with teams, being able to work at all, and for their health and the health of their family and friends. So.
Nice. Was that all the groups? All right. Well, it is right at the top of the hour. So great to see everybody. And we're off next week. Have a wonderful, safe Thanksgiving, and enjoy those pets in the background, and take care, and we'll see you in a couple of weeks.
Thanks, everybody. I appreciate you.